I'm also the medical supervisor. I'm in charge of the hospital during the evening times. I'm also one of the speakers from Sanoviv. I get sent to different places to speak about what we do here. The biggest usage that we have here for the Acuscope machine will be pain. And pain still is very subjective. What you cannot fake is the sincere look of the patient when it's looking at you and telling you, I feel a lot better. The pain is more controlled. And the fact that you're not using medication and another medication to try to contrast that pain, it gives you a very big advantage. For people who have been under long-term pharmacological treatment, this brings a new approach in not just the type of pain treatment that we can do, but also by releasing the amount of toxic elements provided to the patient's treatment. So it has been very, very effective. For instance, cancer. We have seen specifically the pain control that it comes with the cancer management. Acuscope has been very effective in helping us lower the amount of pain that the patient is experiencing. Right now, I can tell you without honestly that this has become one of the pillars of Sanoviv's treatment. This is one of the foundations of our treatment now. I don't see a Sanoviv without an Acuscope machine now. And actually what we're trying to do is push if we can get at least 3 or 4 of those machines here because of how much demand we have had. But what I can tell you is I haven't found a patient in which the Acuscope hasn't been helpful. I remember one specific patient of mine who had a low back, and this also was creating upper back pain, which was chronically there. For more than 10 years, this patient already had been treated with both type of medicines from the traditional point of view as well as from the alternative side. She didn't have any type of relief from any of both sides, let's call it, the traditional side as well as the alternative side. But she had never experienced any type of treatment with the Acuscope machine. So immediately, actually, we started her on the machine. So we used the machine for 3 consecutive days, and actually the second day, seeing this patient just in the elevator, and she was in tears just because of how much pain improvement she had experienced in just 2 sessions, and this compared to all those years of different treatments and pharmaceutical remedies being used. So I remember that as being one of the most impressive experiences that I have had with the machine as a doctor. This type of technology has helped us to see the human body also from a different type of view. The traditional model will see this only from the biochemical point of view. That's why we use a lot of lab markers and we use pharmaceutical remedies. But it's not, the body doesn't only work in that way. We also have an electrical component that comes along with that biochemical component. So Acuscope gives us that view, let's call it, that view and that freedom to utilize that electrical via to provide not just the treatment, but also to push the body again to that balance and that equilibrium that we call hemodynamics or homeostasis in traditional medicine. I have one leg a little bit shorter than the other one. I use orthotics. So this difference in my length creates a lot of disbalance in my pelvic area and the lumbar area, and when I experience the pain becomes very intense. I mean, it becomes almost unbearable. Being a doctor, the first thing that you use to fix things quick, it will be medication. I didn't have any type of improvement with the medication, and it was pretty much a weekend, so I wasn't here. So the first thing that I did when I came Monday morning was to be hooked up on the machine. I can tell you that I experienced more than an 80% pain decrease just with 1 session. And I'm telling you, I mean, it was very impressive what I experienced. And even though I already knew about how effective the machine was, and of course the scientific principles behind it, but to really experience this firsthand with pain and being treated by it was, in my point of view, amazing. So I think I understand a little bit more my patients when they come out of these treatments with that shocking expression on their faces that, wow, I mean, just like some type of miracle, you get a big change in your overall condition. I imagine when you're dealing with this pain pretty much for the rest of your life, right? And you have been told that there's nothing else to do, or maybe the only way to resolve this will be through a surgery. So when you use an element, almost non-invasive, therapy that is completely pain-free because it's not painful at all, and that removes pain drastically, and that lasts longer than any pharmaceutical remedy without the need of another pill or another shot, it is amazing. It is amazing. This is not a technology that it's new, first, and second, there's a lot of research out there. The problem is, if it doesn't come maybe with a front page that says a big pharmaceutical industry, doctors will not be interested. So we need to forget about that. We need to forget about the fact that the only industry that provides good research is the pharmaceutical industry, because that's not true. So there's a lot of research about it. I think I will invite any physician first to do the research and then experience it from themselves. And it is amazing, I guess, but it's only when you have the will to open up your mind to explore other type of resources to heal, it's when you're going to become, I will say, a believer. Search for somebody who has the right experience and the right knowledge. And in this case, John Thorpe has a lot of knowledge in regards of how to use the machine. And just with actually 2 minutes that you talk with him, you can feel this passion and this sincerity of how much he knows about this type of technology and machine, and how really his soul and heart are put into this type of technology, and just the fact that he's helping a lot of people with this type of treatments. Even himself, he will tell you himself how much improvement he has had